And moving on to breast cancer. So here we've just got a slide of the stages of breast cancer. And unfortunately, we have some of the worst breast cancer rates in the world also. So breast cancer is the most common cancer in women in Australia and New Zealand, and the most commonly diagnosed cancer globally. It's estimated more than 3,500 new cases of breast cancer will be diagnosed this year in New Zealand, which is about 9 people per day. The risk of being diagnosed with breast cancer in New Zealand for women is 1 in 9. And only approximately 5 to 10% of breast cancers are associated with a strong family history or a known genetic mutation. So what's causing it? The risk increases by about 6% for each 5 kg increase in a woman's weight. And why is this? Well, adipose tissue, which is fat tissue, turns androgenic precursors into estrogen through a process called aromatization. The more fat tissue you have, the more estrogen you have produced. Another reason for obesity leading to high breast cancer rates may be due to the high levels of insulin and insulin-like factors that can stimulate the growth of cancer cells. The body mass index also plays a role in survival of patients and is an independent predictor of overall survival in patients with breast cancer. Results of a study showed that post-menopausal women who were obese, so with a BMI greater than 30, at the time of breast cancer diagnosis, had a lower disease-free survival and overall survival compared to non-obese women. Alcohol. So, alcohol consumption is the most established dietary risk of breast cancer, thought to be due to the increase of endogenous estrogen levels it causes. Your relative risk of breast cancer is increased by 7% of each additional 10 grams or 1 standard drink of alcohol consumed per day. A large meta-analysis of 222 articles finding even that light drinking, so up to 1 drink per day, increases the risk of breast cancer in women. So that's, lower than what our Ministry of Health recommends. The risk increases further with each extra drink. In a case control study, alcohol consumption with a 4.2-fold increase was one of the main risk factors for breast cancer. Meat. Researchers who published a study in the British Journal of Cancer in 2007 performed a survival analysis to assess the effect of meat consumption and meat type on the risk of breast cancer in the UK Women's Cohort Study. Between 1995 and 1998, a cohort of 35,372 women were recruited, aged between 35 and 69 years, with a wide range of dietary intakes. They were assessed using a 270 food frequency questionnaire. Results showed that a high consumption of total meat compared with none was associated with premenopausal breast cancer, and high non-processed meat intake compared with none also had an increased risk of breast cancer. Larger effects were found in postmenopausal women for all meat types, with significant associations with total processed and red meat consumption. Processed meat showed the strongest association for high consumption compared with none. Women, both pre- and postmenopausal, who consumed the most meat had the highest risk of breast cancer. So high fat. Results of a meta-analysis on cancer and nutrition showed a significant association between saturated fat consumption and the risk of developing breast cancer. The study included 2 randomized control trials and 1 large multi-centre prospective cohort study with 9,966 breast cancer patients. Results showed that post-diagnostic low-fat diet reduced risk of recurrence of breast cancer by 23% and all-cause mortality of breast cancer by 17%. The meta-analysis suggested the post-diagnostic low-fat diet can improve breast cancer survival by reducing the risk of recurrence. And dairy foods. So dairy food is a complex mixture which includes nutrients and non-nutrient substance.
Dietary fat in dairy is a source of estrogenic hormones and may be related to worse breast cancer survival. This study evaluated associations between high and low fat dairy intake, recurrence and mortality after breast cancer diagnosis.
The study found that overall dairy intake was unrelated to breast cancer specific outcomes, although it was positively related to overall mortality. Low-fat dairy intake was unrelated to recurrence or survival. However, high-fat dairy intake was positively associated with outcomes. Those consuming larger amounts of high-fat dairy had higher breast cancer mortality, higher all-cause mortality, and higher non-breast cancer mortality. The higher risk appeared consistent across different types of high-fat dairy products. And it also turns out the breast also has a microbiome, which can get to the breast by translocating from the gut. It's
quite new research, but essentially what we eat can influence the bacteria that then colonize the breast, as well as producing, or the effects, the inflammatory effects produced by the gut can travel to the breast tissue and cause issues there, but it's quite new science.